Assalamu alaikum. Good morning, everyone. Thank you. Thank you for the Saudi Society for Simulation for this opportunity. Thank you, Dr. Tariq and Dr. Amani, for the invitation. And special thanks to my colleague Ahlam and my boss here, Ms. Iris, for the support that they've given me. And I'm so happy today to share with you our simulation-based experience, nurse's journey in PediSTEP, Pediatric Simulation and Education Program in King Abdullah Specialized Children's Hospital in National Guard. Okay, we have a case of 6-month-old boy, non-syndromic microgenetia, went to OR today for GT insertion. During assessment, patient have stridor and difficulty in breathing. So this case, the patient just during the second attempt of intubation, patient while preparing for intubation, just a simple airway maneuver was able to relieve the patient's stress, relieve the patient's respiratory distress, and the patient was able to breathe and prevent a second intubation attempt. So we had an issue. What we did is we designed a simulation program based on this case. During that simulation program, we focused on team dynamic. How do you come every day and prepare to work, to think critically and make sound critical judgment? By simulation, we help the nurses to work in a challenging, to work easier in safe environment and in a challenging situation that they face every day. Okay, so as Dr. Said Jamil yesterday, we saw yesterday about the human factor in the Institute of Medicine report in 1999 to Err is Human. Dr. Said Jamil yesterday spoke a lot about the human factor was the leading cause of medical mistakes. So simulation was mentioned 18 times as a possible part of the solution. So can we utilize this as well in healthcare system? The answer is yes, we can do it. So healthcare system is a challenging situation where the high risk for error is there. So we took the experience from other institutions like aviation and the army and the nuclear station to help in the situation, the high risk, low frequency situation that we have, like for example, extravasation and code blue situation, where it is a very small amount that you need to intervene immediately, and if not, that will lead to harm to the patient. So the goal of the patient safety is reduce unexpected patient harm that occur during delivery of healthcare. So how do we prevent those unexpected patient harm? By practice. How do we practice? By simulation. So is simulation is the solution? Yes, it's one of the solutions. So to go back to our healthcare system, we have issues. Yes, we do have, and admitting that we have issues is one of the first part of the solution to that problem. So how do we utilize simulation in that one? Here we started our journey. So this is our journey, how we started in PediSTEP and nursing program. We started by brainstorming. We met together with all nurse managers and clinical resource nurses of all pediatric units. We sat together, we identified the problems that we have, not only current problem, potential problems as well, anticipating the future needs for education. Need assessment in King Abdullah Specialized Children's Hospital. All the pediatric units are specialized units, so one unit's needs is different than the other. So we sat with all the units, put their needs assessment, what are they going to need? For example, one of the units is post-surgical care. The things that they will need, for example, is EVD management, for example. How to anticipate emergencies for patients with AVD device. Others is chest tube management. So not all units receive patients with AVD or chest tube. Those needs are specific for that unit. So our need assessment was unit specific. Then we put a priority list. We decided to make it in waves. So wave 1, we started already with 5 programs that already launched. So, and then wave 2 will start, and we put it in waves. Faculty selection, we chose certain clinical resource nurses that have proven capabilities in simulation and education, and we designed a program for them to become more expert in simulation. The second one is staff development or faculty development. I will talk about it in the next slide, but we started with Train the Trainer workshop for all the staff and other team members. Advertisement, we advertised, we designed brochures that I will show you in the coming slides. We distributed to all the, as much as possible we can from the units. And then we made a large poster we posted in all the units for easy access for them. And we took the opportunity during the SEM week activities of 2020 to advertise our programs as well. Program launching, as I said, we advertised the launching of the programs in the SEM week activities in 2020, and we started in October of that year. So faculty recruitment and training, we started with Train the Trainer workshop for all the staff, not only nurses, but multidisciplinary team, just to make sure that everyone have the background, medical background different than the other. It was interprofessional, and it includes everything from concept of simulation, designing of programs, how to start, how do you identify the needs, write objective, write scenarios, program proposals, and the mannequin technical operation as well. And it included hands-on practice as well, from writing the scenario until the debriefing of the scenario. Our established programs, this is the brochures that we designed. We had 5 programs that were launched in October of 2022. Chest tube management, extravasation management, ECG management, early signs of respiratory distress, and tracheostomy. All these programs were designed by the clinical resource nurses. So a group of nurses, they sat together, identified the problem, wrote the objective, the scenario, and everything. We validated the scenarios with them, and then we sat with them for the first sessions, and then from that date until now, it's running twice per month. Each one is twice per month session, and they are doing extremely well. Here is some photos of the programs. The first one on the left, the upper left, is extravasation management. They used Moulage to do extravasation, and they asked the staff to intervene. And then at the end, as you see, they sit in a safe environment to do a debriefing session with all the staff that attended. Quality, simulation, and patient safety. We participate as well in quality and patient safety programs. For example, we have the CLAPSI prevention simulation-based program. It's a hospital-wide simulation program for all cash, for all the registered nurses to attend. The program itself is led by nurses. They attend, they do a survey before attending, and then they will do one of the 7 core competencies that we have, while the facilitator will do a checklist. After, they will debrief and hear from the peer feedback from the other attendants as well. After they finish 3 months after, they will do the session again, and then they will fill another survey. So it's in a collaboration with infection control program and quality department. To keep current with what is happening around us, during COVID-19 pandemic, we tried to help as a simulation team. We tried to help as much as we can. So we did help in 2 levels. First one, hospital-wide. We did a program, hospital preparedness program, collaboration with infection control. We checked if the system is ready to receive those patients. So it was a patient, a simulated patient that came from from home to ER triage. So we traveled with the patient from triage ER, going to patient registration, from there to resus unit, and then patient needed X-ray, patient needed intubation. All this time, the team was observing and taking note of the readiness of all the units while going. From there, patient transport to ICU unit, and then after ICU, patient needed emergency OR. From there, we went to OR as well, and the same thing happened. At the end, we gave them a concise debriefing with all the team members about the hospital readiness. We found a lot of issues, and it was all addressed together with the infection control department. Education video modules with all the new guidelines that we had after the pandemic. The staff level was very high. New guidelines, they don't know what to do, so we try to minimize the staff stress and enhance their understanding of those new guidelines. We did educational video modules. The first one was non-invasive ventilation, intra-facility transfer, intubation procedure, cardiopulmonary resuscitation. Each one of those modules had a scenario written. We edited, we took multiple videos, we tried to, a lot of people to see how it was done, to see if we missed something so they can review, to make sure that what we present to people is the right thing to do. And just a disclaimer, all the videos that we did not use anything from the hospital, from the gowns, the face mask, the goggles, everything. We just design it. Low cost, and if you don't have, it's fine, you can make it. We made them, and we utilized them just to minimize the resources on the hospital and make sure that we present a correct image to the public. Collaborated programs, nursing programs, we don't only work together with nursing, we have interprofessional simulations together with pediatric residency program, PICU fellowship program, ER fellowship program, and the other multidisciplinary team. For example, we do weekly mock call simulation in pediatric inpatients area, where we go with the mannequin in situ simulation, where everyone will participate from nurses, physician, RTs, EMS, pharmacy. All the code blue response will have to attend and be present for the situation, for the event. After that, we will debrief the whole unit. It's a way to enhance the team dynamic and effective communication, and to make sure as well that the system is working properly and we have all the resources available if we have a real situation. Challenges. All programs have challenges. Ours were faculty recruitment. We had faculties, but they are not dedicated faculty for us. They have prior engagement, they have prior jobs. So what we did is we created volunteer program just recently that we will start next year, inshallah. We asked people who are interested and self-motivated to start with us in simulation. We will do all the training, we'll train them the same as when we selected the first batch of faculties. We will do all the training, we just needed them to be interested and dedicated to be with us. Staff attendance. In the beginning, we had issues of no-shows, low registration of the staff. By the time we minimized the number of, the time of the sessions to 30 minutes. And during working hours, we don't want people to come from home to attend our sessions. During working hours, if they have 30 minutes that is free, they can open our webpage and they can see available sessions, and they can attend or register, see if there is available registration, and they can attend any of our sessions. The other thing is we recruited the help of our management. Thank you so much for our management for the support. And they supported us by encouraging the staff to be there and attend. For the staff themselves, the first ones who attended, they were scared at first. And then by the time they encouraged other colleagues to come as well and attend, because it will be a chance for them to participate in a simulation scenario in a safe environment where there is no judgment to be had. Staff feedback. All our session, we ask the staff to give us their feedback. We have a barcode posted in our area that they can scan and give us their feedback, and it's online. They can do it at home. They can do it anytime. They can just scan and give us their feedback. We review it after. Nursing program and research. As you can see, we participated in a number of research, so all our efforts is there. Effect of pediatric mock code simulation program, resuscitation skill and team performance. This is one of the papers that we work with Dr. Tariq and others. This is before the starting of our pediatric simulation. This is the effort of the 3 years that we did mock code simulation in all the area without even having a space of simulation lab. So, steps to success. Design, start simple. You don't need high equipment. You don't need high fidelity mannequins to start. You just need a simple equipment. Provide solution. We are problem based. Find the problem, identify this, work with simulation as a solution to that problem. Low fidelity, innovate. A lot of the time we don't have resources, as I told you about our experience in COVID-19. Other times, like the difficult airway, we had a situation that we had a sentinel event where a difficult airway were involved, and we were requested to provide simulation sessions. We don't have the mannequin itself, and it will take some time. What we did is we created one from just small parts that we collected. We are looking all the time. We are looking at YouTube for homemade simulation things that we can, and it was successful. The other thing is Dr. Tariq is always doing it for us for the simulation of central line insertion, the blue phantoms. Just small things, not expensive, but you can do it. Just try to innovate and have ideas out of the box. Stakeholder, have objective outcome. Try to get your stakeholders to buy into your program, like we did in research. The research came before the opening of the lab. That's how we got the stakeholders to get interested. We have research, we have proven ideas. We have this number of staff. In 1 year, we trained this number of staff of this attendance. This number of specialties are involved, so please support us. Build a dedicated team. Find people who are interested, dedicated to simulation, passionate about simulation, and try to help them. Collaboration, try as much as you can to collaborate with other team members. It will give dimension to your program, and it will help you get more people interested in your program. At the end, just a photo of our opening day ceremony. This is all our team members from anesthesia, pediatric surgery, hematology, nursing, medicine, infection control, pharmacy, and if I missed someone, please, they're all there in the picture. So thank you so much for having me again, and have a good day. Thank you.